COVID-19 alert level 4 briefing. Today we have a full range of people available to you. After the Director General and I have departed, the Minister of Education will come in, while of course maintaining social distancing, to talk you through our distance learning package, which I'll speak to very, very briefly as well. This afternoon you'll also have a chance to hear from the Commissioner of Police and Sarah Stewart-Black, the Director of the National Emergency Management Agency. But for now, I'll ask the Director General to give us an update.
Thank you, Prime Minister. Kia ora koutou katoa. So today there are 50 new cases to report of COVID-19, made up of 26 new confirmed cases and 24 new probable cases. There are no additional deaths to report. So there are now 282 reported cases of people who have recovered from COVID-19 infection, an increase of 41 on yesterday. The new total of confirmed and probable cases is 1,210. Today there are 12 people in hospital with COVID-19 infection, including 4 in intensive care, 1 in Wellington, 1 in Waitemata, 1 in Counties Manukau and 1 in Southern. 2 of those people are in a critical condition. For the cases we have information on, we are seeing a strong link to overseas travel, though that continues to decline. As a proportion, it is 41%, as well as links to confirmed cases in New Zealand at 43% and community transmission at 2%. We are still investigating 14% of the cases. There are still 12 significant clusters, and the numbers for our 3 largest clusters are at the Marist College in Auckland, 84. The Matamata cluster has also 84 and Bluff 81 cases. In terms of testing, yesterday there were 4,098 tests processed, bringing the total number of tests carried out to date to 46,875. That yesterday was our highest number of daily tests, and the 7-day rolling average is now 3,343. Our testing capacity continues to increase despite that increase in the number of daily tests, and we now have stock for just under 50,000 tests, and that continues to grow. I know there is interest in healthcare workers who have been infected with COVID-19, some of whom have travelled back from overseas and or have acquired it locally, either in the community through being contacts of existing cases or indeed potentially in the workplaces. We do have a breakdown of those workers, and the biggest categories are there are around 20 support and care workers working in both hospital and or care in the community settings, 17 nurses, 7 are in administrative related roles, there are 7 doctors and 3 medical students. We do know, as I said, that around a quarter of those health workers affected have actually travelled back from overseas, so they've acquired their infection offshore, and we are working on a breakdown to determine of those who have acquired the infection onshore here, what proportion was inside the workplace and what was outside the workplace. We've also been able to collate all the data on laboratory testing and break that down by District Health Board and look at the ethnicity breakdown, and we'll be providing that information on our website. We are still waiting to complete the data set to include the Waikato lab data. And so far though, if we look at the 35,000 people for whom we do have testing, if I look at the ethnicity breakdown, 13.6% are Māori, 7.8% Pacifica, Asian is 12%, European and other 64.2%, and Middle Eastern and Latin American 2%. We will provide those data on our website and update them regularly. Final comments, flu vaccination. I just want to encourage people who are in that category who receive publicly funded vaccination, pregnant women, people with pre-existing conditions, and those over 70. It is essential travel to go and get your flu vaccination, and practices have got ways to vaccinate you, including coming out and doing it in the car if in some cases. Please do. That is essential travel, and it's very important to get those vaccinations now. And that goes for other care you might require at your general practitioners. Do not hesitate going and receiving either care for an acute condition or your usual care for chronic conditions you may have. That is also regarded as essential travel, and you will not get in trouble with the police for doing so. We do have plenty of flu vaccine supply that has been distributed in a managed way from the centre. I will now hand back to the Prime Minister.
Thank you, Director General. As Dr Bloomfield has highlighted, today we have the highest number of tests reported in any one day and the lowest number of new cases in 2 weeks. We may yet see bumps along the way, but as I said yesterday, I remain cautiously optimistic that we are starting to turn a corner. It's all the more reason to stay the course of our self-isolation as a nation. As I said yesterday, we have also surpassed 1 million New Zealanders being supported by our wage subsidy scheme. One of the key principles of the wage subsidy scheme is that we keep people connected to work. There's another sector that's doing this alongside us, and that is our primary sector. You will have seen earlier today that the Minister of Agriculture highlighted one of our star export performers, horticulture, that is keeping New Zealanders both fed and in jobs at this really important time. Overseas workers traditionally fill many roles in our fruit and veggie growing sector, but as you can imagine, the action that we've taken as a government at the border has meant fewer overseas workers have been available. And now, amid our kiwi fruit harvest, we're seeing reports that those workforces now have over 90% New Zealand staff, compared to 50% last season. Last week alone, more than 100 staff were placed into roles in the Bay of Plenty, Auckland and Nelson. The pip fruit industry, made up of apples and pears, has seen around 200 workers from other industries placed into jobs across the country. So today, I want to give my thanks to our food producers in every part of that workforce for continuing to look after us and for the actions in that industry to make sure that people remain in employment. Now, I know there are some workers on our orchards at the moment from the Pacific, working hard here while Cyclone Harold crosses their homelands, particularly Vanuatu and Fiji. And I can understand the worry that you will have for your families. A quick update on that front. This morning, a P3 Defence Force aircraft left New Zealand to provide much needed surveillance of damage. I expect that that will actually be happening as we speak. We also have the C-130 at the ready to deploy with essential supplies. In the meantime, our thoughts are with particularly the nation of Vanuatu as they come to grips with the impact of that cyclone and understand that we, of course, are still building a picture of just the scale of that cyclone as we speak. Today, I also have an update on how our aviation relief package is supporting our industries as well and keeping our isolated communities connected. You'll recall that we set aside $600 million in our COVID relief package to support this key part of our transport infrastructure. As you can imagine, air freight connectivity is really critical for our remote communities. They also help ensure we receive urgent supply of medicines, PPE and critical equipment. We now have 8 initial support agreements with airlines and a ground handling company around the country, totalling up to $4.7 million. And of course, we need to make sure our regions are easily able to access critical time-sensitive freight, food, medical supplies, blood donations. So the Chatham Islands now have their Airlink secured, and Air Chathams is making 3 trips a week, making sure residents get what they need. This package is also providing support to the likes of Air Napier and Barrier Air. In addition, most of our high-value goods were carried overseas in passenger aircraft, and of course many of those are no longer flying, and so we've stepped in. Supported by our relief package, Air New Zealand has now made 17 flights since Monday last week to Shanghai, Hong Kong, Los Angeles, San Francisco and Sydney. At least 18 more flights are planned over the next 10 days. They are taking food overseas and returning with cargo, which includes PPE, hand sanitizer, thermal imaging equipment, test kits and flu vaccinations. We know we need to do more though. This is not just a short-term challenge, so we've committed $330 million to supporting international air freight over the next 6 months. We've received 16 proposals from airlines and carriers all over the world to help critical air freight continue, and we're evaluating those proposals as we speak, and we'll have further announcements later this month. A message though to any of those critical exporters or importers needing capacity on these flights: contact myfreight@nzte.govt.nz. Finally, school's back next week with the beginning of Term 2, but it will look a little different to begin with during COVID-19 Alert Level 4. I know I personally have been thinking a lot about parents at home with their children at the moment. I've seen so many of the ways that you've entertained them during this time, but we have a role to support you. Directly after this press conference, the Minister of Education will detail extensive distant learning package to help every learner across New Zealand, be it providing handheld devices, hard packs of materials, dedicated television channels or online resources. Households will have access to at least one of these alternatives, so parents are supported to keep their children learning at home. And finally, you will have heard clear messages from the police around the Easter break and what to expect. Message here is really simple. Alert Level 4 lockdown remains in place and there is absolutely no change to the rules. That means churches and other places of worship will remain closed over Easter weekend, and I know that will be an enormous disappointment to many New Zealanders of faith, but I ask religious leaders to ensure there are not congregations coming together. Many places of worship are catering for communities using Zoom, YouTube, Facebook, and even the House Party app, I understand. Please go to your faith's website, get more details of how you can connect and worship over Easter, but please do stay at home and save lives and enjoy your staycation. We're happy to take questions.
Given the fact that you said that New Zealand looks like it's turned a corner and the number of cases that we've had for the third day in a row has been decreasing, are you definitively able to give us the government's position around whether or not you're considering extending the lockdown at this stage?
No.
When will you be able to tell us?
As I've said all the way through, and the Director General, I'm sure, will not comment on this too, I have cautious optimism, but now is the time to stay the course. That means we need to continue to uphold the rules of Alert Level 4. And the data that we'll be making that decision on is in real time, and we need to see more of that. We are only halfway through before we can make those decisions.
I think just to build on what the Prime Minister said, this new data we've got on the lab testing by region and by ethnicity will be a key input, and to look at also the positivity rates in different regions. So yes, we've certainly got some promising signs, but we want to be sure that there are not any community outbreaks of a small nature out there that we haven't located. We're confident, but we will look at our testing over the next week or so to make sure that we are identifying any if they are there.
What regions would be more likely to stay in lockdown if the lockdown was extended? Would it be only cities where spread is more likely?
Yeah, ultimately what we want is control of the virus. And as the Director General has said, the way that we can assess whether we have that control is by having that data. But we've also said all the way through that data will help us decide what happens not only with Alert Level 4, but whether or not there are certain regions that may be in a better position than others.
Prime Minister, how disadvantaged are some school children who don't have access to the internet or devices, and do you have a sense of how many households are in that position?
In terms of access and connectivity, my recollection is it is tens of thousands who don't have that level of access, and that might be because of simply devices or, again, connectivity issues. The Minister of Education should be able to give you some of that data. There are two things I would want to say though. One is Nigel Latter very recently said really to New Zealand that actually in this time don't put too much pressure on yourselves. That actually children can have an educational experience while they are at home, and it doesn't mean that you have to become a teacher pushing all of the materials that you feel that you have to in a homeschooling style environment. So parents do need to go easy on themselves with their expectations. Children will be learning in many, many ways right now, but at the same time, we want to keep them entertained and engaged. So providing that material at home actually helps take the pressure off parents at the same time. So that's what we're looking to do.
Still the case.
You talked about wanting a watertight system. Are you erring more on the side of across the board mandatory quarantining, or would you look at just mandatory quarantining in just from particular hotspot countries that have higher levels of cases?
Across the board. And I indicated on Monday, you'll recall, Monday morning, that we were working on stepping up our border controls once again with no distinction, in the way that we've had no distinction to date. everyone who's been coming through is being screened for symptoms and screened for their isolation plan, and it hasn't been based on where people have been coming from.
Fair enough,
Would
hotel
they
rooms
not
and
be able to leave the mandatory quarantining? Would they be like those initial people who were put into the whangaparaoa?
Yes, it would be based on that model. And as I say, that's something I indicated on Monday. That's me sending a bit of a message to those who are planning on coming home in the near future. We are considering advice this week, and we'll have announcements to make off the back of that. Sorry, what was?
Do you have an update on the Peru flight, the numbers registered and the departure date?
Yes, I do. So we have 49 who have registered so far. We do not at this stage have a departure date. Of course, what we need to know is how many we'll have on the manifest, and we need to work with the government to get slots available, but we are working at great haste.
Is it possible that that flight could also stop off in other areas in South America?
That's something I would need to ask MFAT directly. Of course, we do know that there are other New Zealanders in that part of the region. But I do understand that they are looking at securing passage for some New Zealanders who have been stranded in some more remote Amazon towns, and that's via, though, an Australian charter. So we're constantly looking at ways to work in with others or use existing charters that we have in the most effective but creative way possible.
What about Kiwis stuck in the Pacific?
Sorry?
What about Kiwis who are stuck in the Pacific?
As you can imagine, at the moment, there is a bit of a focus on what we can do for those stranded in Vanuatu. So the P3 is going in first. As soon as we get word from Vanuatu around additional essential supplies, the C-130 is at the ready. And then alongside that, we'll be looking at plans to evacuate New Zealanders who are there as well. I understand we have some in the north. And also in Port Vila, I understand.
Field, are you able to give us more details about the Auckland events and workplace clusters, including what, where, and where they came from, and if that was overseas?
I don't have any more detail, but if you would like to, we can provide more detail on the website, including whether there was a link to overseas travel and what part of Auckland they may be in.
Information's been quite hard to come by. Shouldn't it be easier for the public and the media to find it?
Well, we are trying to provide an overview of each cluster and where they are. So if there's more information you would like, I'm happy to take that away and we can add information. We're trying to be as open as possible with information, and I think if you look at our website, there's a huge amount of information on
I think
there.
what you'll find is that some of those clusters did have identifying features in them, but then after we had privacy issues with one of those clusters come up, then the clusters became a bit more anonymised at that point. So I imagine probably what we can do is go back and look again at some of those descriptors because they did previously have a bit more detail attached.
There wasn't.
I'll let Director General finish his sentence.
Sorry, so just actually while we're on the subject of clusters, I gave a figure before of 84 for the Matamata cluster. Actually, that was not the right figure. It's 62 today, an increase of 3. So the 84 was on the Marist cluster in Auckland.
Just to follow up, that anonymity, does that outweigh public health?
No, I'm not arguing that. I'm just pointing out that that's what's happened, I think, with the information that you're referring to, is that we previously had, for instance, Marist next to one of the clusters. That changed, as I understand at the time, when we had the issue with a person's name being used. But as the Director General said, I think we can go back and look at whether or not we can put in a bit more detail, because we're giving you the numbers against those clusters. We can probably label it that way too.
Has the government received any advice yet regarding Ruby Princess?
No, not yet. Once I have an update, I'll be happy to provide it, but no, I haven't received that advice yet.
Businesses are saying cash flow is the biggest killer for them, and the wage subsidy can only do so much. Are we looking at providing some cash flow for businesses other than those loans?
Yeah, I mean, I think if you look at some of the three key areas, of course, wages, and we've stepped in with the wage subsidy. And the thing that differentiates us from many other countries, is that we work to get that out the door straight away. So over $6 billion helping over 1 million workers. The second big expense, of course, often will be leases. We are working on ways that we can ease the pressure there, support businesses as much as we can. The third area will often be servicing debt to banks, and there we again just really encourage business, reach out to your banks. They've said that they are going to operate in an environment where they take account of hardship.
Phil O'Reilly saying the government shouldn't pick and choose whether it's leases or whether it's wage subsidies, and that they should just provide a blanket sort of a cash injection like Australia is doing.
Well, actually, when you look at their JobKeeper, it was framed very much around what we did with our wage subsidy. So very similar schemes in that regard. What he might be referring to is their first iteration, which had a small cash injection, but actually the value of that for most businesses would be much smaller than what they got through the wage subsidy.
Why are some people with
Yeah.
COVID?
Toba.
Why are some people with COVID symptoms and healthline referrals still being denied tests?
You're referring to Maris there?
Are you referring to the Maris cluster from this morning? That was highlighted this morning? Yes, so I would be very surprised if people with COVID-like symptoms now are being denied tests, because the protocol that Healthline has been using for over a week now under the new case definition is much more inclusive. I listened very carefully to the story this morning, and it was clear that the Healthline staff were using the appropriate protocol at that time. I think the person involved did a very good job of making sure she persisted, and then when the definition was broadened, she was tested. The test was negative, but she's still classified as a probable case and treated as such. And the other point I would make, just a reminder about the Maris cluster, when the school was closed, all staff and students were treated as close contacts and isolated as such. Final point on that one, and for all our clusters, is I've asked my staff to talk to the Medical Officer of Health who's overseeing each cluster to get a